Hi, my name is Carrie Bolton, and I'm going to be doing a physical examination of my patient. I've already obtained her height and weight, vital signs, which are all normal, which is blood pressure, pulse, respirations, O2 level, and temperature. And then I've also already got the room set up with everything I need. I've provided privacy, and I've established a relationship with her. I have her positioned and ready. I've already spoke with her about her health history. Then also got her mood, affect, and memory, which are all normal, and she does not use drugs or alcohol. So for the first thing that I'm gonna do is first the head. I'm gonna palpate the scalp and just make sure there's no lumps or anything in there, and the hair is normal. There's no excessive dryness or anything like that. So then I'm going to look at her general appearance, make sure everything looks symmetrical. Her eyes look symmetrical, her mouth and lips look symmetrical. For cranial nerve 7, can you smile for me, wrinkle your face for me, and then I want you to puff your cheeks out for me. Okay, good. And then for cranial nerve 5, I want you to touch your cheeks with your tongue and open your mouth and close it, and then also open it for me to check for your TMJ. Okay. Then what I'm going to do from there is palpate the mastoid process, which feels normal. I'm going to palpate for the parotid gland, which feels normal also. Also going on in to check the submandibular and submental lymph nodes and the sublingual salivary gland there. Also going to be checking the sinuses for any tenderness and checking for the facial lymph nodes also. Okay. Then I'm going to ask you to stick your tongue out for me, okay, and say light, tight, dynamite.
Light, tight, dynamite.
And that's for cranial nerve 12. The next thing I'm going to have do is look at your eyes. So everything looks symmetrical, they're equal, looking at the conjunctiva and the sclera, and the sclera is the white of the eye. Everything looks normal there. So next I'm going to turn the lights down, and I'm going to use my light to look for the corneal reflex, and should just be in the same spot both places, and they are. Okay. So next, what I've already checked her acuity, her color vision, and her 3D vision. Now I'm just going to check your pupils. They look, like I said, they look equal. The size is equal. Now I'm going to check the accommodation of them, just make sure that they're active to light, and they do very great with that. Okay, all right, and then I'm going to do your check confrontation, which is your peripheral vision, and this is cranial nerve 2. So I'm going to have you put your hand over your eye, and I'm going to put mine over here, and I want you to tell me when you see my finger come through, and I'm just checking her peripheral vision with mine, and now it's going to be.
I see it.
Okay.
I see it. Okay.
I see it. Okay. And that was all normal because I was seeing it at the same time that she was seeing it. So now what I'm going to be doing is checking the 6 cardinal positions, which is cranial nerve 4 and 6. So I'm going to have you follow my finger with your eyes. Okay, very good. Okay, so then I'm going to palpate just around the orbit of the eye, and also down to the bridge of the nose, and then also right here at the lacrimal apparatus, which is tear duct. Okay, so next I'm going to check your ears, and for that at first I'm just going to, can you hear that right there?
Mm-hmm.
Can you hear that?
Yeah.
Right there? Okay. And then the next thing I'm gonna do is come behind you and I'm gonna whisper a word and I want you to tell me what that word is.
Purple. Purple.
Now what I'm gonna do is I'm gonna check the Weber and Rhine test. So this is with the tuning fork. And I just want you to tell me when the vibration stops.
Stop.
Okay. And then I'm going to, with the Rhine, that you put it on the mastoid process and just tell me when the vibration stops.
Stop.
Okay. And then we do it just right outside the ear for the conduction of the air vibration.
Stop.
Okay. And so the air vibration should be longer than up against the mastoid process. And so then the next thing I'm going to do is to look in your ear. So I'm going to turn the lights down. Okay. And of course for this you pull up and back. Looking at the 10-minute membrane. And it looks normal. Okay. Coming to the other side. Oh, sorry. And it looks normal also. Alright, so next we're going to be doing the nose. So let me turn the lights back on. Okay. So just looking at the external nose, for the smell test, I'm just gonna make sure that you can smell that alcohol. Okay, don't wanna like tear you down there. So then, just inspecting for any abnormalities like septal deviation or anything like that. I'm just gonna use this light also here too, to just look inside at the internal structures, septum's not deviated, and everything, the mucosa and everything looks normal, no dryness or anything like that. And then now onto the mouth and the throat. So looking at the landmarks, which would be, open up for me, of course I can see, sorry, I've got her hard palate, soft palate, uvula, tongue. Everything looks normal at this point in time. Teeth look normal. Let me get this to do a gag reflex. Okay, and that is intact. Also then I'm gonna have you point to the roof of your mouth, and I'm gonna look at your, if you look down kind of too, so I can look at your salivary gland. Everything looks normal there. And then I'm just gonna get some gloves on really quick. Also, when I looked in her mouth, I looked at her tonsils, which looked normal. Also, in the back of her throat. So now what I'm doing is just looking in her mouth, gonna check both sides of her tongue. Both stick out for me, and I'm just gonna move to the side there and look, move the side here and look underneath. Okay, and everything looks normal there. I didn't see any lesions or anything like that. So next what we do is go to the neck, where I'm looking for symmetry. The trachea looks centered, there's no deviation there. Have you do the range of motion of your neck, go to the side, to the other side, back, and then forward. So range of motion is normal there. Now I'm gonna have you push against my hand. I'm just checking just with your jaw, kind of go like that. Looking for resistance, and she's got good resistance there. Try it, shrug her shoulders. Okay. And then what that is cranial nerve 11. Then I'm gonna palpate for your cervical lymph nodes. And there's also some occipital ones back there too that you could palpate to feel. Okay, and everything felt normal there. I didn't feel anything abnormal. The next thing I'm gonna do is check your thyroid. So what I'm gonna have you do is when I tell you to take a drink of water, if you'll do that for me. And I want you to kind of tilt your head forward just slightly and then slightly to the right. And I'm gonna push this way and take a drink for me. And I could feel the thyroid whenever she took a drink. And now I'm gonna have you slightly like that. Take another drink to check the other side. And I could feel it that time also. 3. And so when palpating her thyroid, it felt normal. So now I'm going to go on to the posterior and lateral portion of the chest. What I'm looking here for, of course, is symmetry, and that I'm just going to pull your shirt up and look, that skin looks normal. Of course, throughout this whole thing, I'm looking at the skin everywhere. Accessory muscles are normal. She's not like in any distress and having to use her accessory muscles. So the next thing I'm going to do, the contour also looks normal, is I'm going to do the symmetric expansion. So I'm going to put this here, and then if you'll take a deep breath for me. And they symmetrically move together. Deep breath. Okay, good. So then the next thing I'm going to do is the tactile fremitus, where I'm going to have you say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and that was normal. So then what I'm going to do is actually just listen to your lungs. You'll just take deep breaths for me. Okay, so breath sounds were normal and of course clear. Didn't hear any wheezing or ronchi or anything like that. So next I'm going to have you say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and so the bronchophony was normal. Now I'm going to go on to where she will say E for me and check that.
E, 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 E,
Okay, that was also normal. Now I'm going to have her whisper 1, 2, 3 each time. Just 2 more times. Good job. So now I'm going to move to the anterior portion of her lungs. Okay. For that, I'm also looking for symmetry, shape. Accessory muscles are not being used at this time. Sternal contour looks normal. Now we're going to get to where one thing was that I should come back around and palpate your spine. So that felt normal also. Sorry about that. So coming back around to the anterior side, now I'm also going to palpate the sternal region, contour of the chest. I don't feel any lumps or anything. Everything feels normal. Then I'm also going to do where the symmetrical expansion at your xiphoid process. So just right here, and then if you'll deep breath. And so my thumbs move out together symmetrically each time she's breathing in. Okay, good. So the next thing that I'm gonna do is also the 99 up front here too.
99, 99, 99, 99, 99, 99, 99, 99.
And that's just for the tactile fremitus. Then I'm going to palpate her regional lymph nodes, the supraclavicular, which feel normal, and then the inferior clavicular. Okay, good. Now I'm going to listen to your lung sounds in the front here. And breath sounds were normal, they were clear, no rhonchi or wheezing noted. Next I'm going to do, have you say 99 again for me.
99, 99, 99, 99, 99, 99.
Okay, now if you can say E for me.
E, 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 E.
Now whisper 1, 2, 3 again. Okay. So now what I'm going to do is I'm actually going to palpate your axillary lymph nodes. So I want to get the lateral ones here. Oh, sorry. Ticklish. Outer ones, lateral of the arm. And also going to go inside here to the mid, and then the anterior fold, which everything's feeling normal. And then I'm going to come back here to the posterior fold. I'm going to do the exact same thing on this side. Try not to tickle you as much. So just getting the lateral portion here on her arm. The middle part. Anterior. Coming on down some to make sure that we don't fall any down in this area. And also the posterior. Okay. Then also we're going to do the parasternal, which is just to the sides of the sternum. And that all feels normal also. Okay. So now what I'm going to have you do is lay down for me so that I can check your heart. Thank you. So I've got her in like a 30-degree angle here, semi-Fowler's position. So what I'm first gonna do is I'm just inspecting first that I can see like her carotid, visibly see it. I can. And then also I'm looking that there's no jugular vein distension on both sides. I don't see any of that. So the next thing that I'm going to do is I'm actually going to palpate the carotid. And just feeling for the contour, the amplitude, which is the force, and the rhythm, which all of that's feeling normal. Just do this one. Okay. Now what I'm going to do is actually listen with the bell of my stethoscope to see if I hear any brutes. That was normal. Now I'm going to ask you to take a deep breath for me and exhale and hold. Listening for any thrills. And hold it once you exhale. Okay, and then we're going to try it one more time and do the other side. If you'll inhale, exhale, and hold. Okay, and everything was normal there. So now what I'm going to be doing is inspecting her apical pulse, and so the maximal pulse, the point of maximal impulse is right here about the 5th intercostal at the mid clavicular line, and so I do palpate that, and that should just be a gentle tap. Then I'm also going to palpate around the pericardium just to make sure that I don't feel any thrills. Which is normal. Okay, so then what I'm going to do is with the diaphragm of the stethoscope, I'll just listen to that one spot, that pulse, point of maximal impulse for 1 to 2 minutes. This is how long you would normally listen. And also, if you can palpate the carotid at the same time, when you feel it with your hand on the carotid, and hear it at the same time. Okay. And so the next thing that I'm going to do is just check your heart sounds. So this one here is the aortic region. And the pulmonic region. And then the tricuspid region. And the mitral region. Okay, and everything was normal. Okay, now we're going to look at the patient's abdomen. So I'm going to pull her shirt up just a little bit. First, just inspecting it, and her abdomen is flat. Umbilicus is midline, it's not inverted or anything like that, so it all looks normal. There's no inflammation, no scarring. She doesn't even have striae or nevi. And then it's not taunt or glistening either, so everything is normal in that aspect. So now I'm just looking too to see if I can see a pulsation, and I can. It's right here of her aorta, which is normal, especially in people that are thin. Then hair distribution, there's not really any hair distribution there. So now what I'm going to do is just listen to her mouth sounds. And first start in the right lower quadrant. And her bowel sounds were normal. They weren't hypoactive or hyperactive. So next I'm going to listen to her stomach for any bruits. First starting with the aortic. And the renal on each side. And the common iliac. And then the femoral. And that was normal. I didn't hear any bruits. So next we're going to go into lap palpation. Just making sure there's nothing bulging, no umbilical hernia or sagittal hernia, anything like that. My muscles feel normal there. Okay. And next what I'm going to do is check the superficial abdominal reflex. And so when I just stroke her abdomen, and it did, it should contract at all of these strokes. Okay. All right. So then the next thing is going to be the deep palpation, where first I'm going to use my two-handed method, and I'm just going to palpate for your liver. Sorry. Okay, and then for your spleen. And then your aorta. And the next thing I'm going to do is your kidneys, but I'm going to do hold back here, and then just do a deep palpation there. Okay, I'm going to come over to this other side and do the other kidney. And I'm just again going to hold my hand back here, push it down with this hand, feeling for the kidney. Okay, and everything felt normal there. So what I'm actually going to do next then is go into her femoral pulse. It's good, and while I'm there, just feel around for any lymph nodes. And then on this side, femoral pulse. Normal also, and then also you have to feel around for any lymph nodes there. Also at that point you can feel for any bladder distension, and she would have noted if any of that would have been tender. And then also hair distribution was normal, no rash or swelling. So now I'm going to have her set up so that I can check her upper extremities. Okay, so first I want to look at her hands. Of course, as I said before, always looking at skin everywhere we're at throughout the whole system. Looking at capillary refill, which is normal. Okay. All right. So There also is no clubbing noted to her nails, which gives you an idea of their oxygenation. The next things I'm going to do is just check her radial pulse, each side, which feels normal on that side, and normal there also. And checking the brachial pulse. Okay. And both sides normal. So then I'm also going to be checking here for the epitrochlear lymph node. And that feels normal also. And again on this side. Okay, so then next we're gonna do the Allen test, where she puts a fist, a hold pressure to both the radial and ulnar arteries. And I want you to open your hands. And when I release from the ulnar, her hand flushes. Good. I do this. I get this. Both radial and ulnar arteries. Open your hand. Open and release the ulnar, and it flushes. Okay. So that was normal. Also, so that's good. Now what we're going to do is check your range of motion. So just want you to bring your arms up, bring them out, and bring them down behind you and down. Okay, now test your shoulders. Now we're going to do your elbows, if you can just out and in. And then we're going to do your wrist, down and up and side to side. And then for your fingers, we're going to do an eagle spread. Then I want you to do rapid thumb to fingers. Good job. Make fists on each side. Good job. Now we're going to do the Fallon's test, which is where I want you to put your hands together like this. Awesome. Hoffman's test, I'm just going to hold your hand out and flick on each side. Okay. And then next I'm going to check your strength. So first I want you to put your arms out like this for me, and I want you to not let me push them down, not let me push them up. Okay, bring them out like this. Don't let me push them forward, don't let me push them back. Good job. Now bring them into your hands like that. Don't let me push down. Okay, and don't let me push up. Awesome. Now that was normal also. So now what we're gonna do is use the reflex hammer. And we're first gonna do the bicep. We'll do inside here. And then solid reflex there. And then solid reflex there. Then we'll go ahead and do the triceps, which you hold up like this. Got it that time. And bring it up. And got it that time. And then also we're going to do the brachioradialis.